Greetings from Washington, D.C. This is another very special edition of Politics Aside, where I take the opportunity to introduce friends of mine that I think are changing the world one day, one step, one motion at a time. And today, we want to talk about something that's near and dear to all of us, and that is healthcare and the challenges from educating to, of course, the delivery of professional services. And I have two guests today from Roseman University that are in Utah and in Nevada. Roseman University, we do have president and co-founder Dr. Renee Coffman is with us today, and also Tom Metzger, who is also vice president of Roseman University. Before we get into the full details of the conversation today, again, I wanted to just recognize the fact that Roseman is on cutting edge of finding unique and important ways to deliver healthcare into the community. And in many cases, that may be mobile. So today, I want to turn it over to Stephanie Walker, who is our senior vice president at the Porter Group, to really start the conversation. If you would, please, Stephanie.
Thanks, Congressman. Yes, I'm really excited to be joined today by Roseman University, who we work with pretty closely, who has a presence and footprint over in the West, like you said, Utah and Nevada. Before we dive into a really cool program called Genesis that we want to learn a little bit more about, Dr. Coffman, Dr. Metzger, can you tell us a little bit more about who Roseman is and what you guys do over there on the West?
Sure, Stephanie, thanks. Roseman University is a private, not-for-profit university who was founded by myself and two other co-founders in 1999. We started in Henderson, Nevada, and still are in Henderson, Nevada. We started with a college of pharmacy. And the reason that we started the program was because there was not a college of pharmacy in the state of Nevada, and there was a huge shortage. As we matured with our college of pharmacy, many of our partners came to us and said they needed nurses. So we started a nursing program. We expanded into Utah with our pharmacy and nursing programs there. And then we added the first dental medicine program in the state of Utah. We now have also a College of Graduate Studies that produces master's degree programs in biological sciences and pharmaceutical sciences. We are on path to start an MD granting medical school at our campus in Summerlin, Nevada.
And, right now, I don't think there's anyone who would deny the existence of a healthcare shortage, just both from an access point of view, but also from a healthcare worker point of view. And maybe Dr. Metzger, you can weigh in on this too. How is that shortage impacting Roseman, if it is at all, in terms of program changes or enrollment changes, things like that?
Well, I think, Roseman has always been responsive to the needs of the community. That's been one of its driving forces in addition of new programs. And that's obviously what's led us to, as Renee mentioned, starting out with nursing in 2006 and looking at a medical school. The need for professionals, especially doctors and nurses, but there are also other professions where the lack of healthcare professionals, especially in Southern Nevada, drives what we do. The medical school, I think the key there is you need physicians focused on primary care. I think this medical school has a very unique mission and a very unique approach to the way it hopes to train doctors and especially keep doctors in Nevada. That's one of the major themes for the medical school, is keeping those doctors in Southern Nevada. And there's an understanding, I think, perhaps even conventional wisdom amongst the community, political and leadership, that graduate medical education, or GME, is the solution there. But that focus, I think what I like about our medical school is it adds a new dimension to that, which is when we're looking at recruiting students and building pipelines from students, especially within Southern Nevada and Nevada more largely, is taking students that are first-gen students that are looking to come into the medical school program, and perhaps they come into Roseman, they graduate, and they do their residency at Harvard or at UCLA or at Johns Hopkins. Those students, and they have evidence from this from a prior institution. The College of Medicine's leadership team has is a cohesive team that had experience together at a prior medical school in a different region. But what they were able to establish was that those first-gen students, if they come from the community, if they train their residency elsewhere, it doesn't matter. It doesn't mean they won't come back and won't serve those communities because their ties are usually very strong. So I think that adds an additional and complementary dimension to it's not just GME. There are other ways that we can do this. And there's great support for that program. So it really opens a lot of doors for us.
Doctor, if I could ask a little bit about your facilities. I've had the honor to have been to your facilities and have seen firsthand the infrastructure and what you've created there on the campus. So, Dr. Coffman, can you tell us a little bit about your facility and how it works as you're recreating the training for healthcare professionals?
Yeah, we have a very innovative way to train and educate healthcare professionals. And we've actually trademarked the name. We call it the 6-point mastery learning model. And the idea behind this is that we want every health professional that graduates from Roseman University to be highly competent. And so in terms of our facilities, we've actually designed our facilities to really support the learning model that we have. Our classes are not the typical stadium classroom seating where people can hide in the back row. The classrooms are hexagonal shaped so that there can be a lot of interaction between the faculty and the student and students with each other. We emphasize a lot of collaborative and cooperative learning between the students. And this is important because it mimics what they're going to see when they get out in healthcare. There's no one that's an island in healthcare, and you have to learn how to communicate with people from different backgrounds, people from different professions. And if you don't get practice with that when you're in school, like we do at Roseman, because we put our students in teams from day one, and we really have developed a very nice curriculum centered around interprofessional education, where our pharmacy students, nursing students, dental students, and eventually our medical students will all be training together. If you don't do that while you're in school, it's much more difficult to do that once you get out. So the facilities that we have are really designed to help facilitate the learning, but at the same time, they're very amenable to students. Students love learning in our classrooms, and it's a pretty exciting place to be, really. Place to learn.
So go ahead, Steph. I'm sorry. No, please.
Yeah, I was just going to say, I mean, I think that gives us a really good background about who you guys are. I do want to briefly ask, though, you have a couple of campuses. You have both Nevada and Utah. What differentiates the two? What are you offering the same programs or both, or what makes each unique?
So the way that we've grown has really been very unique with those two campuses. We sort of have started with a program in one location and then expanded to the other. So the two campuses both have pharmacy and nursing. The Utah campus is the only campus where we offer the Doctor of Dental Medicine degree. But complementary to that, we have two dental residency programs that are also offered on the Henderson campus. So we have an advanced education in general dentistry degree program, as well as an orthodontics program here. The nice thing about that is, again, it's a residency program, just like you would see with a traditional medical doctor. But the training is such that we also offer care to patients in the community. And that care is typically at a much reduced price. So for members of our community here in Southern Nevada or in Utah that want to come and get dental care from our dental students and our residents, of course, supervised by faculty, it's sometimes as much as half to 2/3 the cost of it would be as it would be going to a more traditional dentist office. And it's cutting edge because we have to show that our students are cutting edge, that the next 50 years of practice, not just the last 30 years of practice. So those facilities are very much cutting edge, and any patient that walks in is going to get absolute best care.
Well, while we're on that subject, of course, facilities, state of the art, quality of education, state of the art. why would a student choose Roseman over another institution? And I know there is none like Roseman, and we could get into the specific differences, but when a individual of whatever age category is choosing, what would they pick about Roseman that you'd like to share, with those that are listening today?
Well, that 6-point mastery learning model that I talked about is very student centric. It is really designed to help students succeed. In fact, I just welcomed a new class of pharmacy students this morning. And one of the things that I always like to say to new students when they come in is, when I went to pharmacy school, because that was my first degree that I got, I walked into pharmacy orientation, and one of the deans said to the entire class, look to the left of you, look to the right of you. One of those people will not be here when you graduate. And we have really turned that on its head. So I always say, when I welcome a new class of students with this 6-point mastery learning model, look to the left of you, look to the right of you. One or more of those people is going to help you achieve your goal of graduating and passing the board exam. So that's one thing. It's very student centric, but maybe even more importantly is the actual outcomes. So the outcomes of that 6-point mastery learning model have been really phenomenal. I mean, our last nursing class, our last dental class, both had 100% pass rates on the boards exams. Obviously, you need to pass the boards before you can practice and actually earn a living as a pharmacist, doctor, dentist, or nurse. And so this model really works. And with our dental program, it is now, the other two programs have always been shortened timeline from traditional programs. Our dental program now just began offering a 3-year Doctor of Dental Medicine degree. And we do that in a way, again, that's very student centric. The cost of education has gone down because it's 3 years instead of 4. So it is significant in terms of the cost savings to the student. But secondly, when a student graduates a year earlier, they get out a year earlier, they have an extra year of earning potential. So when you really compare apples to apples, our private educational model, with our students finishing in less time than they would in more traditional settings, makes us very cost competitive with even in-state tuition.
So when I was a member of Congress and had a strong focus, as today, into healthcare and in fact seniors, young adults, and children, one of the things that we discovered and had numerous town hall meetings across the country to talk about healthcare was the challenge of finding trainers to train the students. So what are you finding in your world as far as finding the professionals that will want to train and train the trainers? What's happening?
Well, I think, again, we've been very fortunate. We don't really have high turnover rates amongst our faculty, number one. But number two, we tend to attract faculty who are very much also in tune with this 6-point mastery learning model. So you do have cadres of professionals out there that are really do want to make a difference in students and students' lives and their education, and they really gravitate toward this model. So we've been able to attract very high quality faculty, and more importantly, retain those faculty. Some of the faculty that were in today's orientation session with the pharmacy students were saying, yeah, this is my 10th year at Roseman. This is my 15th year at Roseman. So we've been very fortunate. Now, having said that, the overall, that's Roseman specific, but overall, it is true that the shortage in healthcare professionals becomes even more concentrated when you're looking at those healthcare professionals who are willing to or want to train the next generation of healthcare professionals.
And Stephanie, I know you've been working very closely with Roseman and the team. And one of those areas that you've been talking extensively about is the Genesis program. Stephanie, can you kind of give a perspective of what you're seeing and what we're doing to assist with the Genesis program?
Yeah, so we'll get into the Genesis program here, which is this pretty, the technical term I think is really neat program that brings healthcare out into the community. to address the holistic health needs of individuals before they or after they're within the healthcare system. I'll let the team talk about some of the goals, but I know some of the goals are to address issues which can cause chronic healthcare concerns before they become chronic. This is going to be targeted at neighborhoods who historically do not have equitable access to healthcare or equitable access to groceries or clean air or, the things that cause other healthcare concerns. So, Renee, Tom, please jump in. Tell us a little bit about Genesis, what it is, and why Roseman has decided to adopt it and bring it to their campus areas.
Tom, I've been doing all the talking, so I'm going to let you jump in here with Genesis.
Well, I think this is really consistent with the vision of the dean, Dr. Joe Greer, because there's a huge emphasis on social accountability in the College of Medicine. And so the focus of care in the Genesis program is the most underserved areas in the community. And the center of that is the household. So the term household-centered care has kind of become a thing, within Roseman and within Genesis, because the care actually takes place in the household. It's not an individual patient necessarily that's the center of that healthcare provision. It is the household, because there's so many things that are connected and that are interconnected, whether it be the members of the family or whether it be different aspects of what that family is experiencing. Or do they have food insecurity? Do they have housing issues? Do they have other ancillary issues where the wraparound services can be provided? Genesis provides a central role, not just in the healthcare, but in provision of services that are basically improving outcomes of the folks within those communities. As an example, it's been demonstrated and it's been documented that you can go into those households and you can save the overall system money because you're keeping those individuals who will be heavy users of emergency rooms by the services that are provided by Genesis. They're staying out of those emergency rooms. And it's very easy to quantify the value of that. An emergency visit costs X $1,000. We can demonstrate that we saved 150 of those last month. It's multiplication from there. So the value to the community, the value to the health system, all of which is evident and runs across the system. So I think the vision of social accountability, I think Dr. Greer is really passionate about, we go into these communities, we take their blood, we take their data, and we go away. And you wonder why they don't trust us. And I think that's really important point, is to go into those communities, to have the expertise that the leadership team in medicine has to build trust, to enable that possibility of them really improving their outcomes. I think that's kind of the way I would describe Genesis overall.
Thank you. And I know, I think the both of you have gotten a chance to see Genesis pretty up close and personal in terms of what you're able to provide. Can you give some examples of some of the unique things that the Genesis team helps with that is related to healthcare that people might not even think of when it comes to making sure people have access?
Yeah, I actually did a ride along with the Genesis team a few months back and went to a household where the gentleman who needed care had been in the hospital, had some long-term health issues. And one of the first things that they did when they walked in there, and I should also mention that he's married. His wife did not speak English very well. She was the one that was sort of triaging things that were coming in and out of the household. And it turns out that his biggest problem that day was not necessarily how he was feeling or his current medical status. His biggest problem that day is that he had been receiving bills from the hospital that his wife was tucking away because she couldn't read them and she didn't understand them. And she felt like they couldn't pay it anyway. So she had this stack of bills that had gone unpaid. And so what the Genesis team did was they immediately got on the phone with the folks at the hospitals who typically will have some sort of a plan to get people current on their bills. And doesn't mean they have to pay the full amount, but they can pay it over time. And it was amazing just to see the relief on the face of both the husband and the wife in that setting, that it had been taken care of. The Genesis team is bilingual, so they were able to explain a little bit more detail about the billing and the process and why it was important for her not to stuff those bills away for months at a time. But just that, the relief on their faces to say, okay, well, somebody was in here to help and understand my most important problem that day. That's another thing that Dean Greer has sort of drilled into this program is most medical professionals are trained to think sort of in a tunnel vision, and they'll walk into a patient and say, okay, how are you doing? What's wrong? What's your major medical complaint? When that may not be the most important thing on that person's mind at that time, or even the thing that's going to move that person forward toward health and resilience. So, so I thought that was a great visit for me to go on to really see the benefits of Genesis. And then to have our students integrated into that Genesis program when we have medical students and we get our pharmacy and nursing students involved is really important. You can maybe say that in a textbook, but it's not as just upfront and in your face as when you're actually in that patient's home, sort of seeing how they live, seeing what issues they confront, and then helping them to deal with that and understanding what wraparound services are. So, maybe the docs that graduate from Roseman will be much more inclined to say, hey, you know what, I need to hook you up with social services here, or I need you to hook you up with this, maybe it's a church oriented place that's providing food, Meals on Wheels or something like that. So just sort of thinking outside the box and recognizing that patient and their household are a whole environment or a whole system, and you have to think about it from a systems perspective instead of this narrow focus of, well, today I've got a cut on my wrist that doesn't seem to be healing, whatever.
I guess to admit the fact that I'm of that vintage, when I remember our family doctor would come to our home and be carrying this leather bag with all of the tools of the trade, I guess at the time, stethoscope and maybe something to tap on my knee. But I still remember how much better I felt. The fact that the doctor and or his staff cared enough to come to our home. And of course, my parents would never abuse that privilege, and it had to be pretty serious. But I still remember that. It changed my life when it comes to a public servant and delivering and trying to change the world one person at a time. So I applaud you, I commend you for there's more to medicine than prescribing some medication, and there's more to healthcare than visiting an emergency room. It's about that one-on-one. So what you're explaining and what I think is so cutting edge and bringing healthcare back to where it used to be, I think is really tremendous. Are you running into many obstacles with the Genesis program? It isn't new, but yes, it is in this environment.
Tom, I don't know if you want to talk about it, but we do have, obviously we have partners in our community that are very helpful at directing us to some of these households that need help, or helping us to identify some of these wraparound services that we talked about. But just like any other startup, probably the most difficult issue that we face, we are a private institution, so we don't receive state funding or anything like that, but some support to help us offset getting this started. And that's a lot of care that we're providing to the community. Again, as Tom mentioned, there is a real economic impact to the community when we're able to find these things earlier, keep people out of emergency rooms, keep people healthy, ensure that they become resilient, so they aren't continually using government supported programs necessarily. All of those things are important, but it takes some startup funding to help us get over that initial hurdle.
So from an insurance perspective, how does it work? Are there challenges with insurance? Is there a line item that the Blue Cross Blue Shield can look at and go, yes, this is covered or not? Or what are those issues regarding insurance?
So there are so many issues. Many of these households may be on government subsidized programs. There are some issues that, in fact, the household that I visited, Because the wife worked, it put them just above the poverty level. So they didn't qualify, but at the same time, it was clearly difficult for them to get the full realm of services, and clearly they still had difficulties paying those hospital bills, which is why the wife was stashing them away. So there are those that do kind of fall through the cracks. And, again, in some cases, it's just helping those folks be able to identify resources that might be available to them and get them on those programs. So yeah, it is challenging. But in the long run, kind of circling back to an element of the question that you asked was, in the long run, these will help save healthcare costs overall. And when we can reduce those healthcare costs, keeping people out of the emergency room, keeping people healthy, getting them to resiliency, that lowers the cost overall for everybody. So it really is a very positive economic impact, as well as a positive health outcomes impact that this program can have.
Well, I'm
One of the
gonna,
unique-
yeah, go.
sorry.
Sorry, Steph. No, please. Sorry.
I was going to say one of the unique features of the program is, of course, that it's mobile. And I like that Congressman Porter sort of reminded us it's actually a bit of a return to the way we used to do medicine. So there's it's both new and old, but in a time when everyone is concerned about air quality and climate and what's the role of electric, I know you guys at Genesis are doing some pretty unique things with your mobile fleet. So I don't know if you can talk about that a little bit, your electric cars and the art program you guys have that made that possible.
I don't want to do all the talking, so I'm going to hand this one to you too.
Yeah, this one, as I understand, again, this is mostly through the College of Medicine. So there are 2 electric vehicles that are used regularly by Genesis for the household visits and for that outreach. Each one has a unique theme, and we have reached out to local artists to develop the design for those cars. The first theme, I believe, was mental health through a local artist, and so that's one of the electric cars. The second one, the theme escapes me at the moment, but we do have those 2, and we had a different artist design the second car. Again, maybe food insecurity was possibly the theme associated with that car, but it's it's all about that outreach, community building, and I think to add to what Renee had said before, in terms of the value add in Genesis, one of the struggles we've had, Congressman, is I think it's just getting that message out there of what this is and what it does. Even internally, we've had discussions, what is Genesis? And so, we've asked this question a lot, but I think, there are a couple things to latch onto. Household-centered care, the interconnectedness of the household and the household as the unit that is receiving that care. And then, as Renee mentioned, both the community and the economic benefit is clearly there, but sometimes difficult to demonstrate. I think that is, at least in a time sense, can be an obstacle to getting it where it needs to be.
Well, while we're on
see-
this subject of innovative healthcare, I guess a test question is, what is AI doing, and how do you see AI involved with Genesis and other programs that you're working on? Artificial intelligence, chat, GPT, etc.
So I'll step into this boldly, or pretending to be bold, but I think it's going to change the role of the physician. I think there will be some reliance on AI for features that they're traditionally given to the physician, and whether it's their horse sense versus what you're getting from AI in a purely data-driven process. There are obviously demonstrated superiority, if I can use that term, for AI, and say, reading a radiograph or an X-ray or some other type of image. I think there are studies that clearly demonstrate that AI will do that statistically in a superior fashion. So the role of the physician is going to change. How that's going to change and how that's going to manifest itself in the system, like a lot of things with AI, is to be determined. But that's just a few examples.
Well, a lot of us will turn to Dr. Google first, and my finger may hurt, and all of a sudden I'm diagnosing myself with some major disease. I expect that more and more people will be turning to Google Chat GPT and trying to get self-diagnosed. That's got to be a concern as well, right? For healthcare, is overthinking things possibly by a patient, that, or is that a good thing that they first should seek advice from Chat GPT?
That's a tough one because it really depends. Because you laid out both sides. It is a concern and it is an opportunity. I guess I think we all do this. We all Google stuff and look at it, and depending on how you filter that information and depending on how that you use that information, it isn't necessarily a bad thing. However, if you're going in there and you're looking at isolated facts and you're not connecting it to anything and you're not talking to anyone, if you're not reaching out, that input then becomes very questionable and there's risk there. But on the other hand, if you just want access to information, it is there, and sometimes that can help inform you to ask the right questions when you do get access to the physician, assuming that you do. So I think there's opportunity as well as risk associated with that information access component.
Well, I failed spelling in 5th grade, and I turned to any technique that I can to help with proper spelling. So I can imagine what this means for the professional, and if used properly, what a great tool it will be in making life better for so many people. I know we're running in short on time, but Steph, is there some other things that you'd like to address before we conclude today?
I just think in a concluding question, how Genesis is one program that Roseman offers, and if you can articulate it, how is Genesis reflective of who Roseman is in the community?
Well, I think the easiest way to answer that is that Roseman does respond to the needs of the communities that it serves. That's actually even in our mission statement. And so when we identify issues in our communities, whether that is with respect to educating healthcare professionals, identifying particular geographic regions within our sort of scope of influence where we can have an impact, or whether that has to do with the need for care with patients within the realm of healthcare, we look to, it's in our DNA to help try to find a solution to that. And so I think Genesis, along with where we started, our core of offering health professions degree programs to offset the shortage of healthcare professionals that we saw here in the West, in the Mountain West in particular, it just is sort of who we are in the DNA. And I will mention one other program, one that we're really proud of, and it sort of intercalates with Genesis pretty easily. But it was started by one of our actual pharmacy graduates who was a neonatal intensive care pharmacist. And one of the things that she noticed in that unit was how many babies were born with neonatal abstinence syndrome. And neonatal abstinence syndrome is when a baby gets born and they've been, during the mom's pregnancy, she was addicted to substances, bad substances. So this baby has to go through withdrawal, just like an addicted individual has to go through withdrawal. And this most innocent of lives, who it's not their fault, they didn't take the drugs. This baby is born with that type of an issue and a problem from the very get-go. And then that leads to things like, maybe Child Protective Services coming in and taking that child away. Well, this pharmacy grad saw that problem and devised a program that we call now Empowered to deal with that problem. So this provides support to pregnant moms or moms who have recently delivered to help get them off of the substances that have caused them issues and problems in the past, give them support, give them training, give them parenting classes so that they can get off the substances and become a healthy mom that can raise a healthy baby and keep that family intact. So again, Empowered is another really good example of a program underneath Roseman's scope that was started by a Roseman pharmacy grad that kind of shows how Roseman has an impact on the communities that it serves.
Well, Renee and Tom, thank you so much for sharing your vision. And what I see is the prevailing model for healthcare delivery in the country, if not in the world. And we thank you for being true leaders and making the world a better place. So thank you for your time. Excited for your future of the organization and all those folks out there that really need your help. So thank you all. We hope to see you very soon, and we'll see you in a couple of weeks here in DC, right?
Yes, thank you.
Thanks.
All the best. Thank you. Take care.
Bye. Thanks.